Welcome back, everyone. Well, let's move past the phases of birth and discuss some caring for the neonate considerations. Newborns or neonate care must be tailored to meet the needs of the population. Newborn, we would generally classify as the first few hours after birth, while neonate is within the first month after birth. Supporting the needs of both the newborn and the caregiver post-delivery is important. Some general pathophysiology and assessment things to note for the newborn. Skilled care interventions to optimize cardiopulmonary function are required in only about 5 to 10% of deliveries. We've discussed this multiple times that most births are routine and normal and occur without incident. Approximately 8% of newborns delivered each year will weigh less than 5.5 pounds and may have an increased risk for need for resuscitation. But again, generally childbirth occurs without any problem. Fetal circulation has three major blood deviations, and these are physiologic changes that occur at or during birth that will ultimately allow the fetus to engage in its own isolated circulation. So the three shunts that exist are the ductus venosus, the foramen ovale, and the ductus arteriosus. And all three of these should close off after birth. The first breath during birth or post-birth is triggered by mild hypoxia and hypercapnia. At this point, the pulmonary vascular resistance drops as the lungs fill with air and more blood flows into the lungs and facilitates the closure of the patent holes through the circulatory system that allow the exchange of gas during maternal circulation conjunction. Transition from fetus to newborn, if there's a delay in pulmonary pressure, this leads to what's known as a delayed transition. It can result in significant hypoxia, brain injury, and death. Other some treatable causes or things that we need to be aware of during the birthing process that can facilitate this are things like meconium or blood aspiration. Acidosis, hypothermia is a big one. Keep baby warm. Sepsis, birth asphyxia, pulmonary hypoplasia, and respiratory distress syndrome. Newborns are at risk for hypothermia. You should place on pre-warmed towels or near a radiant warmer. Dry the head and body thoroughly. If you are transporting a newborn and you're in the back of the ambulance and you're not sweating, it is way too cold in there. You need to have the heat turned up. We don't have radiant warmers for transport for newborn infants, so you need to make sure and keep the body warm. Once you have delivered and baby is doing well, make sure you clear the area of wet towels or anything that would cause radiant loss of heat or convective loss of heat. Cover the head with a cap. There's usually one in your OB kit, and keep baby warm. Just a note that all babies are somewhat cyanotic right after birth. If the newborn remains vigorous in movement and muscle strength is strong, then that's going to pinken up or should pinken up in most cases and not be any issue. Maintain your ongoing observations, and within the first 5 minutes, circulatory status should be more apparently normal and skin would appear more of a normal color. Continue thermoregulation with direct skin-to-skin contact with mother. This is a great way to keep baby warm, particularly in the out-of-hospital environment. And then during post-delivery, you need to make sure that you're prepared to do your APGAR scoring. This helps record the condition at birth, and more importantly, it gives us an idea and a way to track the progression of infant post-delivery. So your first one should be done within a minute or so, and then you should record the second one at around 5 minutes, and every 5 minutes or so until at least 20 minutes after birth or until baby meets the condition of 10.